Good evening, everyone. Wow, this is quite a microphone. I'm Gary Stockman. I'm the CEO of Porter Novelli. On behalf of the agency, very pleased to welcome you to today's Porter Novelli Perspectives event on the FDA, social media, and the future of healthcare communications. In case that's not an ambitious enough agenda, if we've got extra time, we'll take up some additional issues like world peace, whether Brett Favre really should have retired, you know. Things that are simple to solve, exactly. Social media today, if you watch the video, which incidentally is available on YouTube at
Social Media Revolution.
Social Media Revolution. Really fascinating. If you didn't have a chance to see it, some of the numbers are truly stunning. But social media today, as we know, is a communications phenomenon. We can all see that, but we cannot all aggressively act on it as quickly as we might like, as aggressively as we might like for a variety of regulatory constraints, and that's among the things we're here to talk about tonight. At Porter Novelli, we've become well known for creating dynamic and memorable social media programs for our clients, but we're also committed to doing more and helping to create the new rules of engagement. To be leaders for you, our clients and our friends in the fast-moving world of social media, we have to be more we also have to be industry thought leaders. And that's why we're particularly pleased that you're able to join us tonight for this seminar on the use of social media in an FDA-regulated environment. Now tonight, our first speaker will be Peter Pitts, the director of our global healthcare practice, the president of the Center for Medicine in the Public Interest, a former FDA associate commissioner, and a recognized thought leader in the field of regulatory issues and social media. After Peter, you'll hear from Julie Zawitza, FDA's Assistant Commissioner for Public Affairs. Then we'll have a panel discussion with Peter and Julie, which will be moderated by Stephanie Agresta, who's Porter Novelli's Director of Social Media. And I know that all of them look forward to your questions. And if you have any questions that you're uncertain about asking, just slip Stephanie a note, and she'll be happy to ask it for you. Again, I want to thank you for joining us this evening, and let me turn the podium over to Peter. Thank you.
Thank you, Gary. Good evening. Thanks for coming. Before I start, I would be remiss without thanking Lisa Sizicu and Marion Glick, who helped put this event together. Ladies, take a bow. I have to tell you my favorite FDA story. And Julie, I don't know whether you've heard this.
Oh dear.
I don't drink, and I had a couple of glasses of wine at an FDA event, and I was introduced to this guy, and I heard Mr. Smith, and I said, "It's nice to meet you, Mr. Smith," and he said, "Dr. Smith." Yeah, I prefer to be called Dr. Smith. And I said, "I prefer to be called Dr. Pitts." And he said, "You doctor?" I said, "No, but I prefer to be called that." Social media is a voyeuristic, wonderfully, terribly brutal medium. It's naked in its honesty and its utility, and boy, is that frightening. When Stephanie suggested that we run this video while people were seated, we looked at it and we looked at all of the facts on it, and someone said, "Wow, this is just going to scare the bejesus out of this audience." But I knew that it wouldn't, because we're all thinking about these things every day. We realize the value of social media, but what we don't understand is how to use it responsibly, in a compliant way, in a way that works, and in a way that doesn't get us into trouble. The role of marketing communications is to advance the bottom line and the public good. And in my opinion, not necessarily in that order. And I think we've come to the realization that we need to do both of those things, because giving back is an integral part of what we're now all calling the new normal. And there's really never been a better tool to accomplish this than social media. Social media is the newest arrow in the communications quiver, but as you know, it's a discipline that's both misunderstood and frightening to those of us operating in the heavily regulated world of healthcare, OTC, and other. But, and this is the scary part, just because we're a regulated industry doesn't mean we can hide behind a social media Maginot Line. Social media is a social movement, and using the excuse that healthcare companies can't engage because we're different misses the point entirely. Now, compliance issues are very important, but it's precisely because of this special difference, which is the responsibility to help advance the public health, that healthcare companies must engage, must actively and creatively in social media. As the great social media philosopher Buffalo Springfield opined, there's something happening here, and what it is ain't exactly clear. Now, I think there are a number of key issues relative to the use of social media by regulated healthcare entities, and I want to address four. One, user-generated content. If a consumer with no financial relationship or corporate interest posts a comment on a social media site that's supported by a regulated entity, is the regulated entity responsible for the content of that comment? Now, user-generated content, I think, is de facto interested. Otherwise, there would be no content generation. But does that mean that de jure it should be considered as regulated speech? Where you stand, as they say, often depends on where you sit. And if you sit in Europe, consider a new European Court of Justice ruling that says information about medicines produced by independent third parties without any commercial interest can still be considered advertising, even if a third party is acting entirely on its own initiative and completely independent of the manufacturer. Now, that's carte blanche for an almost complete gag order on anyone who wants to do anything to do with regulated healthcare products in the media. Now, under such a regulatory environment, consider this. Would letters to the editor be liable for an FDA warning letter? What about radio call-in comments? What about freedom of speech? 2, blogs. Why are blogs that accept industry funding and discuss regulated topics different from publications such as the New York Times or the Washington Post or the New England Journal of Medicine that do the same while accepting regulated advertising? When is interest different and distinct from conflict of interest? A related issue is that of user versus property owner. Specifically, websites whose online content is created exclusively by users without any financial interest behind their personal participation. Let me give you a particular example. So, for example, think about a social media site for people with diabetes that's transparently created and maintained by a company that markets a diabetes medicine. What are the responsibility of the property owner of the company, and what do they need to prove vis-a-vis disinterest? And there's another issue, and that's referred to generally as intended to promote. How can intended to promote be differentiated on a social media site from intended to share and educate? And whose job is it to define such differentiation? As Don Draper said, I'm enjoying the story so far, but I have a feeling it's not going to end very well. The FDA, as you know, is having a social media discussion on Thursday and Friday. It's a Part 15 hearing. Now, the general joke at the FDA is that they're called Part 15 hearings because there's about 15 minutes worth of interesting material. This is not going to be the case for this meeting on Thursday and Friday. And I want to read to you one of the statements that the agency put in its Federal Register notice when it announced this meeting, and I quote directly. Are there different considerations that should be weighed depending on the specific social media platform that is used or based on the intended audience? Close quote. What rules should apply when a healthcare company wants to pitch a story to a blog or some other social media site with an audience that's relevant to their marketing strategy? One thing that healthcare companies worry about is that social media commentators will not factually report the news, a legitimate concern. But is this any different than accurately pitching a story to a reporter at the New York Times and then having him miss or misrepresent a key clinical data point? Whether it's the New York Times or a blog or a social media site for caregivers, information in is vetted and controlled. Information out is not.